Community Town Hall of 2022. I'm Colonel Josh Seagraves, the Garrison Commander. Joining me this evening is our special guest from the Fort Belvoir Community Hospital, the Chief of Staff, Captain Syra Aslam. Syra, thanks for being here tonight. Appreciate it. Thanks. So in today's Town Hall, we are going to provide some updates and information on COVID, a hospital update, some Garrison announcements, and then some program updates from our Garrison directors from Housing, MWR, and the Department of Human Resources, or the Director of Human Resources. So, from Housing, we'll have Ms. Jennifer Hudson, our Housing Director, Mr. George Dixon, our DFMWR Director, and Mr. Kevin Rennick, our DHR Director. So just some ground rules. If you have questions, please post them in the comments. Please allow 48 hours for a response to your questions, as always, just as a quick reminder. So, some updates from the commander's desk. Just a few things. First, on health protection condition Charlie. The community risk of COVID is still high throughout our operating region. Case counts are declining, which is great news, but the impact is still felt in the area by our healthcare partners and at the Fort Belvoir Community Hospital in terms of capacity to test, vaccinate, and then contact trace close exposures. I do anticipate reducing the health protection condition level as soon as conditions improve and the Commonwealth of Virginia's state of emergency is lifted. My team is planning for that reduction to potentially occur within the next 2 weeks, but until that time, our current HPCon is Charlie and those mitigation measures remain in effect. Just a few of them, as a reminder, are as follows. So there's a 50-person gathering restriction for meetings and events in DoD facilities. And those are limited to 50 participants unless granted an exception to policy from the Secretary of the Army. If the meeting or event is not critical to support mission, operations, or readiness, then please consider rescheduling that event till the end of the month or at a later date. Masks are required indoors per current DoD and Army mandate. So vaccination, those masks are required basically regardless of vaccination status until community transmission, which is tracked by the CDC, sustains in the moderate category. Fairfax County still remains in the high category. 6 feet of distancing, so physical distancing is still in place to ensure there's enough safety and space to operate. A few other mitigations for HPCon Charlie include food service, and that remains in a grab-and-go and delivery only. Religious services and activities are limited to 50 persons, and just a quick thanks to all of our communities of worship on Fort Belvoir. They've been doing a great job of registering and working through that process. I know it's difficult, but if you can just hang with us, I think it's going to ease up here shortly, but thank you for all of your efforts. Fitness centers are currently still for active duty and first responders to maintain readiness. And then finally, as always, we'll continue to update you as conditions change on Fort Belvoir. They'll be announced through our social media platforms, our website, and the Garrison app, our standard channels of communication. So without further ado, let's get to the interesting stuff. Syra, over to you.
Thanks, sir. Appreciate the opportunity. Hello, Fort Belvoir community. Fort Belvoir Community Hospital has made tremendous progress in the last couple of months with combating the Omicron surge. We've worked hard to lean in and acquire additional testing capabilities, medical treatments, and vaccination sources. But before I review these topics, I'd like to provide you with an update on our community in terms of where we stand with the positivity rate. Rates of COVID in the Northern Virginia area are decreasing overall, but still remain high relative to the low points observed earlier in the fall. Our most recent 7-day average is 53.8 per 100,000, down from a peak of 214 per 100,000 in our population just 3 weeks ago, and the positivity rate in Northern Virginia is still at 13%. Overall, the rate of infection is still around 10 times higher than it was in early November, so transmission in the area, as Colonel Seagraves mentioned, is still quite high according to CDC standards. We do expect that over the next few weeks, rates will start to fall, but there will still be a moderate level of community transmission for the time being. And as such, vaccination, boosters, social distancing, and routine hand hygiene remain the best mitigation measures. Due to the high transmission rates, we are still adopting a conservative and restrictive approach related to hospital visitation, and will reassess this weekly as the rates of COVID start to fall. When it is safe to do so, we will revert to a more liberal visitation policy. I'll now review some changes that have occurred in our testing policy as relates to the Omicron variant. So in terms of testing, our COVID clinic is continuing to test beneficiaries, but in the last couple of months, we've had a significant increase in the volume. The good news about all of this is that over the last few weeks, we've seen some reduction in that volume, and so we will be no longer requiring the fast pass style distribution system of numbers early in the day. And we've been able to kind of go away from this because of the decreasing testing demand over the last 2 weeks. We are also still distributing home testing kits for some dependents to utilize if they would like to take advantage of this opportunity. These kits from the Ellume vendor are 96% accurate compared with the PCR test that we do at the hospital and are free to beneficiaries. Dependents who test negative with the Ellume antigen test and have symptoms can still return to the hospital for a PCR test if their symptoms persist for more than 24 hours. We also will provide input on how to have the results of the Ellume antigen test added to the patient's medical record if there are questions at our COVID clinic. And as such, those results can be transmitted to your primary care provider. In terms of treatments, and we did receive a question about this on Facebook, we do have a supply of anti-COVID therapies now at the hospital, including some of the monoclonal antibodies that have anti-Omicron activity, and we do also have the antiviral drug Paxlovid. However, due to the limited supply of these agents, these therapies are being prioritized by our physicians to the highest risk individuals with severe underlying immunocompromising conditions, for example, cancer patients undergoing chemotherapy and organ transplant recipients. However, if beneficiaries feel that they might qualify, they should contact their primary care provider for an evaluation to see if they might be a candidate for these therapies. The specific question that we received on Facebook was, during hospitalization, is there a standard treatment for COVID-19? And the answer to that is there is a standard protocol based on clinical presentation of the patient and underlying medical conditions. However, it is not a one-size-fits-all approach. We carefully analyze the condition and medical history of the patient to develop a treatment plan that best meets their needs. So moving on to vaccinations, just want to emphasize the importance of getting your booster as a way to reduce hospital admission for COVID-19. So again, it's an opportunity to get a booster. As the majority of the patients that we are admitting are those who are unvaccinated or under-vaccinated, meaning that they have not received their booster shot. Moving on to updates on vaccination, we are pleased to announce that we now have Moderna vaccine here at Fort Belvoir. Some of you may have heard that on Monday, the FDA granted full licensure for the Moderna COVID-19 vaccine, and we are now offering Moderna to beneficiaries over the age of 18. And this includes active duty service members who can receive Moderna or Pfizer, GS, and contract employees. You may have also heard that we have had some changes in the availability of the legacy Pfizer vaccine in the National Capital Region. And this is related to a reduction in the DoD's supply of the legacy Pfizer vaccine in December of 2021. And this has resulted in some changes to our availability for Pfizer vaccination. So at present, Fort Belvoir is offering the Pfizer vaccine to active duty service members, to include reserves and National Guard, as well as TRICARE beneficiaries ages 5 to 11. Pfizer is also being offered to beneficiaries ages 12 to 17, but for the first and second doses only. For beneficiaries 12 to 17 who require a booster, we are asking that the booster vaccine be obtained through the civilian network. And most Walgreens pharmacies do offer booster vaccinations to ages 12 to 17. And so we encourage beneficiaries to look on the TRICARE website or for that reference or their local health department websites to identify information on civilian options for this vaccine. As a reminder, the Fort Belvoir COVID-19 Vaccine Clinic is still located in the Fort Belvoir Community Center. We're open from 0700 to 1500 daily, and appointments can be made through the DHA appointment portal. We are tracking that Pfizer has submitted an emergency use authorization submission for pediatric vaccinations for children 6 months to 5 years of age. And we are standing by to be able to administer that vaccination once it receives FDA approval here at Fort Belvoir. We did receive another Facebook question, and the question was, when will the gray cap Pfizer booster be available for family members? For those of you who may be wondering about what the difference is in the different colors of the caps, gray versus purple versus orange, the gray cap Pfizer vaccine is one that's pre-measured, so it doesn't require dilution like the purple cap does. And so that is ideally better because it reduces the amount of error. So we are awaiting arrival of the gray cap. The procurement is being coordinated by DHA, and as soon as we receive it, we will be offering it to beneficiaries here at Fort Belvoir. At present, we checked again today, we do not have an ETA for arrival of the gray cap. Finally, we received one more question on Facebook about whether or not it is safe to give a child the COVID-19 vaccine. COVID-19 vaccines are safe for children and teens according to the CDC. Before recommending COVID-19 vaccination for children, scientists conducted clinical trials with thousands of children and no serious safety concerns were identified. And the FDA gave the Pfizer BioNTech COVID-19 vaccine emergency use authorization for children, as I mentioned, ages 5 to 15 years old, and full approval to use it in ages 16 and older. The benefits of COVID-19 vaccination outweigh the known potential risks in children. There are approximately 28 million children between the ages of 5 and 11 in the United States, and there have been nearly 2 million cases of COVID-19 in this group due to the pandemic. COVID-19 can make children very sick and also result in hospitalization, and as such, we do agree with the CDC and recommend the COVID-19 for ages 5 and older. And again, once approval is available for younger children, we also concur with that recommendation. Finally, we know that there have been several changes to our COVID vaccine administration plan due to changes in supply and demand. We apologize for any inconvenience that these changes may have caused, and appreciate all of you checking into our Facebook page, which is where we provide the latest updates, and also on our COVID-19 vaccine hotline for any updates on the status here at Fort Belvoir. And finally, vaccination remains the safest strategy for preventing COVID-19 infection, hospitalization, and long-term effects and fatalities. So again, we encourage everyone to consider being vaccinated. Thanks very much for my time.
Great, thanks, Sarah, appreciate it. Okay, just one more update, or two updates quickly before we go to our guests this evening for their updates. The first one is a question and a topic, really, in fact, that we've talked about several times over the last 18 or so months, and that is Walker Gate and the Dogue Creek Bridge. So the construction is complete. Just a shout out to the Baltimore Corps of Engineers for working through COVID and supply chain issues for finally getting the bridge completed. There is a punch list of items when we do these big projects that our Department of Public Works is working through just to make sure that everything, all the loose ends are tied up, so to speak, on that project. And then really the thing that's holding up opening Walker Gate is just the COVID impacts on our guard force. So we are working through 3 mass hiring events this spring. We've already done 2 in the fall that have been successful in bringing on new guards. So you're probably seeing some new faces through the gates as you come in the mornings, and that's at all gates. As our guard force continues to increase, those numbers literally increase, and the decrease in COVID cases, I think we'll see Walker Gate open up soon, probably in the next couple of months. So good news there. The other one that I want to talk about briefly is the Resident Satisfaction Survey. So this is an annual survey that the Army issues. That survey is out on the streets, and it's available to all residents of Fort Belvoir. Our goal is 50% participation. Last year we had about 38%. I just encourage everyone to take the survey. It's your chance to provide feedback about living in Army housing, and it's an opportunity to rate your overall satisfaction with the services as well as the property and the overall housing experience. I'm going to go ahead and address one of the questions about taking the survey, and the question is, what's the importance of taking the survey? Why should I do it? I'm sure everyone sort of has survey fatigue or deletes surveys as they come in or sends them to their trash, right, in their email. If you take one survey this year, make it the Resident Housing Satisfaction Survey. This survey directly informs the Army on not only the performance of the privatized housing companies that operate all over Army and other DoD installations, but it also informs the way we spend money to just sort of the bottom line. So that's both out-year development and then upcoming priorities. For example, last year we had about 38% participation in the CEL survey for Fort Belvoir. What that resulted in, one of the biggest things it resulted in, and you should have already seen a difference, is the landscaping contractor. So the new landscaping contractor is Brightview, and they've already done a very good job with the winter weather events that we've had. So I think that was a good example of the power of that survey and how you can change things if you actually fill it out. So without further ado, I'll go ahead and pass it over to our housing director, Ms. Jen Hudson.
Thank you, Colonel Seagraves. To reiterate, we are currently at 29.8% for the resident satisfaction survey. So our goal is 50%. So if you could just check your emails, and if you don't have an email, reach out to either the military housing office or to your community management team, and they'll be able to provide you directions on how to obtain that email. For those of you incoming looking for off-post housing, please contact the military housing office. Our team will be glad to assist you. We know our partners at 97% occupancy, and we know that this area, the market's tough, so we're here to help find solutions for you. For the villages at Belvoir updates, they continue on tree work. Lewis Village started today, and Vernondale and Harryford are for next week. Spring mulch will begin middle to late February. They have a calendar through their app, Active Building, so please be on the lookout through that for your village. Sidewalk grinding will continue. They anticipate to start that in May, June timeframe. Lastly, the Doe Creek new construction homes should be completed in the springtime, and that will be open to all officers and all to officers of all ranks. And lastly, if you haven't checked it out yet, please check out the new podcast introducing our new ombudsman, Miss Alicia Luster. She is onboarded and ready to be of service. Back to you, sir.
Okay, thanks. All right, our next expert coming up is Mr. Kevin Rennick, our Director of Human Resources. Kevin?
Good afternoon, all. Kevin Rennick, Director of Human Resources, and I just want to say thank you for this opportunity to address you this afternoon. I just have one area topic for you, and that's for ID cards. First and foremost, I just want to reiterate, please, 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 plan early, especially for renewals. So if you're getting to or needing to renew your ID card or common access card, we will support you 90 days prior to those expiration dates. So please go out there, go early. We know that the appointments are challenging, and so we are working through that, but you can help us help you also by re-engaging early enough, 90 days prior to the expiration date, and trying to obtain an appointment. We understand the challenges, again, of obtaining appointments within the National Capital Region. Therefore, ID cards and common access cards, just so you understand, are not just for Army. However, they are for all services. Therefore, being in the National Capital Region, you can imagine that our customer service base is enormous. We have added 2 categories, however, as it pertains to our walk-ins, in which appointments are no longer warranted, which will assist with appointment availability, and that is in the categories for new employees and if the common access cards are non-operable. So in those 2 categories, you do not need an appointment. If you are new employee onboarding, no appointment is needed, and for any reason that your common access card is no longer working, an appointment is not needed. Please go to the Fort Belvoir homepage to Deers and Rapids for future and information. We also have an online process which is sufficient, in which we can also renew the ID card without you actually having to come to the facility. Again, thank you for your time this afternoon, and we look forward to servicing you.
Great, thanks, Kevin. All right, and finally, Mr. George Dixon, our Fort Belvoir Morale, Welfare, and Recreation Director. George.
Good afternoon, sir, ma'am. Thank you for the opportunity to talk about MWR. MWR is hiring lifeguards, groundskeepers, and caregivers. Lifeguard courses are starting February 25th, March 18th, and April 2nd. Cost of the course is $375. Fees for the course will be reimbursed if you apply and are hired to work at the Fort Belvoir Aquatics Program for the 2022 summer season. You can apply for these positions on usajobs.gov. As a friendly reminder, we continue to have mask requirements at our MWR fitness facilities. Please ensure you have a properly fitting mask while using our MWR fitness centers. Army Community Services is hosting a job fair for exceptional family members on April 5th, 2022 for employment opportunities on Fort Belvoir and in the surrounding community. Employment workshops will be provided for exceptional family members at ACS the week before the event. We will host all information on our MWR Facebook page and MWR websites. Thank you all.
Great, thanks, George. Appreciate it. All right, just a couple of questions. So one of the questions, since I should have had George answer this when he was up there, but I'll answer it. When will CYS go back to 100% capacity? So CYS has been challenging, as most of you know. We are following, obviously, and continue to follow DoD listed and given priorities in the policy. But the main question of 100% capacity really at this point depends on two things for Fort Belvoir. The first one is the pandemic, and I'll tell you, many of you haven't seen all of the behind-the-scenes work that DFMWR has done and the CYS community has done to keep children safe, keep them in pods so that we prevent community spread of COVID and other infections, and those pods have actually worked out quite well in the CDC. So I think COVID will be our main limiting factor on capacity at CYS. The other limiting factor is HVACs. So we have about 14 of these HVACs on Fort Belvoir total that are problematic, and they're problematic for the Army. Those three are in the design phase right now of those contracts, and once the design phase is completed and approved, the HVACs will take about 9 months to be completed. So the earliest we would see those would be sometime in the fall, but it'll probably be next spring is when we would plan to bring those other three CDCs online. And that's a very rough timeline because we're still in the design phase now, but it's a good question. Another one is, why can't we open all the gates? So I addressed that a little bit with Walker Gate, and that's primarily due to the pandemic and our guards. However, we do have the 3 mass hiring events for the guards that we're working on, and hopefully that'll help improve our overall numbers for the guard force and help us open up more gates and increase our hours. So that's coming, but it'll probably be coming in the next few months, probably 90 or 120 days approximately. And then finally, there's another question about the CEL survey, so another shameless plug for that. Please go do the survey. Don't delete it. That's the only one you have to do for 2022. Just complete it and help us out. We need about 20% more to get to 50%, our goal. So please do that. And finally, just as far as closing remarks and reminders go, as a final reminder, please continue to do your part and our part, in fact, in ending the pandemic. Continue to follow the current COVID-19 guidance. Wear your face covering, maintain physical distancing, and practice good hand hygiene, as Captain Aslan mentioned. And finally, also, as she mentioned, get your vaccine or booster if you haven't done that already. Additionally, please check out our latest episode of Belvoir in the Know podcast. In our most current episode, the Command Sergeant Major and I introduce our new housing ombudsman, Miss Alicia Luster, and that episode is available, as are all the episodes, on our social media platforms and the website, also wherever you listen to your favorite podcast. Finally, don't forget to download the Digital Garrison app. Yes, I know you've heard me say this before, but we do get credit for that, so please, it is increasing, so I'm going to keep saying it because every time I guess I say it or people are finding out about it, you download it, and we get a little bit of credit for downloading that. When you download the Digital Garrison app, please make Fort Belvoir your installation of choice. You can receive installation updates there, MWR events, and announcements directly to your phone, just as you can on any of your apps. And then finally, thank you for joining us this evening. We appreciate your time during the town hall. Everybody have a good night. Thanks.